Live in a few more minutes. We're just going to give people some more opportunity to join us this morning before we get started.
Good morning.
So welcome back to everyone who joined us previously, and welcome to everyone joining us for the first time. We hope everyone is healthy and safe. My name is Helen Roldan, and I am a Research and Outreach Coordinator for the FIU Jorge M. Perez Metropolitan Center. Before we begin, I will briefly introduce today's webinar, The Current and Future Economic Impacts of COVID-19. Today's speakers will be discussing the local government issues affected by COVID-19. For those that are joining us for the first time, our experts will be sharing a presentation, and then we'll answer questions from the audience towards the end of the session. If you're interested in asking questions, use the chat feature at the bottom of your Zoom screen in order to put in any questions you have. You can do so during the duration of today's webinar. We're going to try to get to as many as possible during the last 10 to 15 minutes of today's discussion. Today's session is also being recorded, and we will be posting the recording on our website. We will also be emailing all participants a copy of today's presentation, as well as a link to the next webinar so you can register in advance. I will now turn the mic over to our center's Associate Director, Dr. Ned Murray.
Ned, you're muted. Ned's muted.
Good morning, everybody.
Good morning.
Well, welcome to the fourth in a five-part series presented by the FIU Metropolitan Center on the economic and community impacts of COVID-19. Today, we will be focused on the impacts on local government, and we have a great panel of presenters, and we hope to hear from you as well at the end. Let me do this. We've switched things around a bit. Normally, Dr. Howard Frank would be doing these introductions. Today, he's one of the presenters, so I'm handling that aspect of the webinar. So let me do this. Let me introduce the speakers, presenters with their bios, and then I'm going to make a couple comments and then turn it over to Dr. Howard Frank, who will be our first presenter. So with that, Howard Frank joined the FIU Public Policy Administration faculty in 1988 after earning his PhD in Public Administration from Florida State University. Dr. Frank's research interests have centered around public budgeting and finance with emphasis on local governments. Howard served as editor-in-chief of the Journal of Public Budgeting, Accounting, and Financial Management from 2014 to 2018, and has authored or co-authored 40 articles and 3 books, many dealing with local government finance. Prior to earning his PhD, Professor Frank was employed by the Delaware Department of Labor and Employment Security, the U.S. Department of Housing and Urban Development, and the Broward County Office of Planning, where he served as a budget analyst. District 8 Commissioner Daniela Levine Carver, welcome. Was first elected in 2014 and re-elected in 2018 to serve as the Miami-Dade County Commissioner representing her District 8. Her district includes Palmetto Bay, Cutler Bay, Homestead, and unincorporated areas of South Dade, including the Redlands, Falls, Princeton, Naranja, Leisure City, and parts of West Kendall. Commissioner Levine Carver currently sits on the following committees: Transportation and Finance, Infrastructure and Capital Improvements, Public Safety and Rehab, and the Community Disparity Subcommittee of the Chair's Public Policy Council. She also serves on the Transportation Planning Organization and one executive board of the South Florida Regional Planning Council. She has served on the Florida Bar Committee on Legal Needs of Children, the boards of League of Women Voters, Orange Bowl Foundation, North Medical Foundation, South Florida Information Initiative, and several other boards. She has won numerous awards from various organizations, including the Commissions on Ethics, Red Cross, American Society for Public Administration, ACLU, National Council of Jewish Women, AAUW, among others. Our third speaker, John Talmadge. John has spent more than 30 years working in local economic and community development, both for municipal governments and national research organizations. Currently, John is the Director of Economic Development for Lee County. Previously, he recently served as the Chief of Staff to the city manager of the city of Fort Myers and served for several years on the Sanibel City Planning Commission. John began his career working for the New York City Council during the Dinkins Giuliani administration, focused on development along the Brooklyn Heights, Williamsburg, and Greenpoint waterfronts. He directed economic development for the city of New Orleans during the Nagin administration and served as a senior policy advisor to Mayors Diaz of Miami and Mallory of Cincinnati. John has left government to serve as CEO, president of Social Compact, where many of us have known John. Social Compact, of course, was a research organization serving the federal regulatory community, cities around the country, and community development organizations specializing in micro-market and demographic research. John has also joined us for a period of time as a senior research fellow in economic development at the Metropolitan Center. He has also served on a number of boards, including most recently the Sanibel Community Association, Fish, Crow, and the Sanibel Sea School. Our next speaker would be Christopher Russo, who's the city manager of Sunny Isles. Chris Russo has served as the city manager for 13 years. And during his 7-year absence from the city, Mr. Russo served under contract as the town administrator of Southwest Ranches, Florida, and most recently as the village manager of Port Chester, New York. During his first stint as Sunny Isles Beach City in 2000 to 2005, Mr. Russo is credited with restructuring this fledgling government and developing the first long-term capital plan, creating a comprehensive procedure manual, and the first market-driven compensation plan. Mr. Russo has also assisted local governments in New York, Maryland, New Jersey, and Florida developing and bolstering a delivery of local government services. He has conducted executive searches for local governments and has presented at more than 30 conferences and group meetings on such topics as innovations in local government, public-private partnerships, economic development, incentives, and leadership in adversity. Mr. Russo has also served in a leadership capacity or as a member of many municipal organizations, including the Florida City County Management Association and the International City County Management Association. And Jennifer Fiscaro, commissioner from City of Sunny Isles Beach, has been on the commission for 6 years. She began her service as the chair of the City Advisory Committee in 2014, a position she held until her election as the commissioner in 2018. As chair, Ms. Fiscaro focused on improving the connection between the City Advisory Committee members and the city so they can better serve as liaisons in the community. As a commissioner, she continues to focus on important issues for the benefit of the community in addition to her services for the City of Sunny Isles Beach. Ms. Fiscaro currently practices family law and is a certified family mediator. Prior to her legal career, Ms. Fiscaro was the writing lab coordinators for FIU's Biscayne Bay and Modesto Medique campuses and taught composition courses for the English department. Welcome all. Just a few words regarding the Metropolitan Center. For those of you who are not familiar with us, we've been around for 23 years. 1997 to be exact was when we were started. And our focus has always been economic development in a number of different senses, working with various local governments throughout South Florida on economic development, strategic plans, doing other more specific studies on prosperity, income inequality, gender studies, targeted industry studies, and more recently, well, actually for the last 15 years, housing policy and affordable housing specifically has really been the focus of a lot of the research we've done. And of course, that ties very closely with economic development. We also do performance and management evaluation. We've been doing training for 23 years, working with local governments and nonprofits. And of course, we are a data center, U.S. Census data center, and we provide that type of information and assistance to local governments as well. We started out with this larger research agenda several weeks ago. The first webinar was actually going on a month now. And it was decided by the Senate that we should undertake this, being Miami's public research university, that it was incumbent upon us given our background, given our expertise in economic development in particular, was to look at the both the community and economic impacts of COVID-19 on local governments, on businesses, on nonprofits, and the very quality of life that's been impacted by COVID-19. So we took this on as a larger research initiative and have since then spun off a number of different elements to that. Last week, we rolled out the community development rapid response impact model, which is available on our website. And more recently, we've also done a similar draft of a response strategy relative to small businesses, which we'll be sharing as well. During this time, we've been asked by a number of local governments, nonprofits, the business community, citizens at large, if there's more that we could provide them. We're getting constant calls and emails, whether it be from the media or whether it be from local governments, regarding what can we do. The uncertainty that surrounds this issue, and the fact that it's so unprecedented. There's really nothing that we can really compare it to relative to prior economic shocks. But more recently, we feel confident that we've been able to get our arms around at least those aspects of it. The health issues surrounding COVID-19, still a lot of questions there, but we're beginning to see, as the weeks and months now go by, what the economic and community impacts are. So with that, we are able to assist local governments and nonprofits and the business community. And we're trying to formalize this in some way, because we're getting so many requests that we've decided, well, why don't we just offer this free consultation service? So you can register with us, and we can discuss that with you, so that we can have a more organized, formalized process in place to talk about what you're dealing with. Just so you know, we are out in the communities. We're doing projects in South Dade all the way to Palm Beach, over to Lee County and Fort Myers. So we are on the ground right now. So we do have a pretty good sense of what local governments and nonprofits and donors, foundations are also dealing with in trying to address these issues, particularly on the economy and also the community impacts, which are getting more and more concerning every day. So with that consternation, we do understand where various communities are coming from. So we want to provide this extra service as well. We will continue with one more webinar next week on the nonprofit sector, but we're also talking about doing special topics beyond then, and we certainly would be interested in hearing from participants on what those special topics might be. I've had conversations recently with the League of Cities and others who are very interested in affordable housing. Affordable housing, we had a crisis before this COVID-19 issue came about. Well, that crisis has only gotten worse. So all these issues, whether it be job loss, inequality, affordable housing, they've only been magnified by the fact that we're now weeks and almost a month into these shutdowns. I should also say there's a number of elected officials on with us today, and we welcome them. And I believe we have representatives from 25 or more local governments. So great to have you all, and look forward to working with you and helping you in any way we can. So with that, I'm going to hand it over to Dr. Howard Frank to be our first presenter. Howard?
Thanks, Ned. Good morning, everyone. I'm going to try to go through the slides very quickly, and please remember that we will send everything out along with our a copy with the YouTube. So if you see references or notes, they're going to be sent, and I'd be happy to give you additional information if you need it. So go ahead, Maria. You can let me just give a kind of overview. Number one, something we've talked about before, I think this event is going to accelerate a lot of trends that were already out there. My nickname is the Great Accelerator. Cutbacks. It's clear this is not going to be a good time for organizations, and there's going to be a need to be strategic. I think a driver which I've put on the table this morning, I think that we are also facing, and this is long term, when it comes to sales taxation, which is part of the local government repertoire and certainly a huge chunk of Florida's income. There is a mismatch between an increasingly service-based economy and a tax that still applies to, in so many words, widgets. I think more than ever, and those who've taken a budget class with me know, I think people in local government have to see themselves as economic development officers. And I think, lastly, workforce development is going to become increasingly central. The type of work and your workers going to be increasingly important. Two of my colleagues, Milena Neshkova and David Go, did a study across 18 Florida cities, 13 counties after, and this is for 08 through 010 fiscal years, how did they deal with the Great Recession? And you can see mostly it was what I might call the usual suspects: hiring freezes, end-to-COLAs, salary freezes, dips into reserve, across-the-board cuts. Then as the recession went on, about a third resort to fee increases, millage increases, and layoffs. Contrary to what I'm seeing a lot of in major universities, or what you might see in the private sector, furloughs and buyouts, very infrequent. On another note, since the Great Recession, there are actually 3% fewer employees in absolute terms, and when you adjust for population, it's 8% fewer. I guess the best way of putting it would be civil servants per capita. That's dropped 8%, and we're going to put out an infographic this afternoon in South Florida. It's in double digits when you increase for inflation. So the bureaucracy has actually shrunk in absolute and relative terms since the Great Recession. Go ahead. You could argue that the last 40 years, we have seen, generally speaking, a decline in growth in the United States economy. Prior to 1990, it was 4%, and you can look by presidential era, it has tended to trip down. I think we were averaging during the Obama years 2%, and we were told that the tax cuts a few years ago would bring us back to a higher rate of growth. I think we've only won 3% quarter. So this has not been we're going into this recession, with relatively declining secular growth, and also our wages have gone nowhere adjusted for inflation. And there might be many reasons for that. Non-wage compensation is probably increasing faster than wages, and we seem to have concentrated pay in the higher rungs. Go ahead. Another thing to take into account, which I wish people in government would pay more attention to, is labor force participation. We are seeing a shrinking percentage of our overall population working or deciding or trying to work. People are pulling out, and it's at near historical lows, and it's going to get lower. If we can look at the research of the St. Louis Fed and others, a lot of that is just aging. It's an aging workforce, but there are other factors involved here. Workforce policies for women not being necessarily family friendly. There's job skill mismatch. I think William Porro is in the audience, and he would tell you here in the middle of Miami, we have a shortage of heating, ventilation, and air conditioning specialists, which you think about that in a semi-tropical climate, what that means. I was out in Denver a few months ago. There was discussion of incarceration and criminal record impeding labor force participation. And last but certainly not least, there's a huge increase in the amount of disability in this country. And that is also pulling workers out of the labor force. But again, that really means that we are in some ways taking out contributors relative to the people who are taking or putting in relative to people who are drawing down on government resources. So, you've heard a lot of talk about this in the context of Social Security, but it's beyond just Social Security. It's who is paying in relative to taking out. So this is an issue that is on the radar screen quietly, and it's one that we have to deal with. Go ahead, Maria. Another thing, and I'm not talking about a wide range of taxes here, property or sales. I'm not talking about user fees either. But one thing we do know, and it's important because it's just over a third of our revenue, both state and locally, is that the sales tax base is shrinking. And you can see 40 years ago, it was almost half of personal income. And today it is just over a third. We're increasingly an economy of services and not things, and that impacts the sales tax base. Now, there's the antidote has been typically to raise the rate. And indeed, I was shocked to see that Hillsborough, Tampa is now a combined 8.5%, the 6-cent sales locally, or excuse me, statewide, and then 2.5 addition added. But typically in Florida, it's around 7, and there's concern that as it gets closer to 10, people start taking evasion tactics. And again, I think this is going to be a bigger picture issue. You don't see it talked about much locally, but the National Association of State Budget Officers, they talk about it a lot. And in terms of intergovernmental revenue in Florida, it certainly is important. So again, we peaked as a manufacturing nation in 1990, and services are becoming increasingly dominant. We did have an interesting effort. Those of us with graying temples might remember we had services tax here for 6 months. It was repealed, and it's an interesting history, but it may provide lessons for where we go in the future, because I don't think this issue is going away. Go ahead, Maria. What's coming next? Well, I'm not a PhD in economics, but I do think I can speculate reasonably. And I think there are 4 factors that augur for a pretty slow recovery, a very sluggish recovery. The first is the cost of doing business. I heard Bob Iger, the chairman of Disney, a few weeks ago. When Disney reopens, it's clear there's going to be screening. Last night, I heard the CEO of Waffle House talking about the steps they're going to have to take when that reopens and how they're going to be adding costs. And I'm sure that that's going to be happening in businesses across the country. Somehow those are going to have to get factored in. I think that the culling of the herd in retail and food and entertainment is, I think, going to lead to, quote unquote, less promotional pricing. I think that as we see contraction in a lot of retailing in particular, there's just going to be less competition. Labor costs. Ned was telling me this morning, Starbucks has added $3 an hour. I'm sure you've heard many establishments are paying more to the people in manual labor, the people who they can't stay at home and telecommute, the people who are stocking our shelves, the people who are doing our deliveries. And I think that will increase costs. And last but not least, I think you're going to have a lot of debt coming out of this economic downturn. And that will be at household level, business level, governments, you name it. And I think that's going to be a factor. So I'm calling it aging myself stagflation light. I think for the next 2 to 3 years, we may have relatively higher costs with pretty limited economic growth. So where does it take us? Well, I think governments are going to have to balance sort of the short-term survival while thinking about the quality of life that retains employers and residents. And that's never an easy trade-off. I think 35 years ago, the cutback literature showed typically protective services were sheltered and everything else got cut. And I don't know if that is going to be a working strategy moving forward. I think the sales tax problem, and as my colleague Maria Ilcheva noted, also motor vehicle taxes, which are declining because of technology and better fuel economy and more electric cars. Yeah, the economy may improve, but the tax base may still be shrinking. And I think that's something to ponder. And I think the third factor is going to be what is the workforce in your community, and what can you do to foster greater participation? And that's, I think, in particular among young people and among those who don't have college educations. What are you doing to assure that they are entering the workforce with skills that are needed? Go ahead, Maria. Okay, I'm sure many of you remember what was the great slogan after Andrew. We will rebuild. You can remember that was the mantra after Andrew. We will rebuild. Okay, so I'm saying we will rebuild as what? I think 28 years has shown we've stayed pretty path dependent as an economy. We're still a low wage service economy. We did not handle the last so-called Great Recession very well. The economy has not really rebounded as quickly as other metropolitan areas. So the question is, what are we going to rebuild as? Are we going to stay path dependent, or will people in local government take this as an opportunity to start thinking about what builds a more resilient, inclusive economy? What are the jobs? What are the careers? What are the professions that government should be fostering and nurturing to lead to a more survivable and a more inclusive economy that can handle shocks like this better? So I hope I stayed in my 10 minutes, Maria.
Thank you very much, Dr. Frank.
Okay. I think I pass the baton on to Commissioner Levine Cava.
Excellent. Good morning, everyone. Thank you so very much for allowing me to join this important conversation. I'm very, very proud to be here representing our county government. And let me first assure Professor Howard Frank that I do indeed see myself as an economic development officer. I've created a local accelerator, small business and nonprofit academies and grants for both. And I am bringing a resolution to the county to create a county-based small business support program in this pandemic. Clearly, workforce development and increased labor force participation are top priorities for our county government. So I was asked to speak first from a 30,000-foot perspective. Oh, and by the way, you'll see behind me here, I do not have a PowerPoint, but I do have a caduceus. That would be for the COVID-19. And I have a crystal ball. So I gaze in it every day and inform my plans accordingly. So we do not have a manual or guide as to what comes next. But public health experts, including Dr. Marty in your program last week, are warning us that we need to have at the very least certain measures in place before we can ease social distancing guidelines. So we have to have a sustained decrease in the number of new cases. That would be over 14 days. We have to have a decrease in the percentage of cases that are positive. And the public health workforce and resources available have to exist to expand testing and to do the necessary contact tracing. I think that's the new probably top Google search word of the day, contact tracing. Everybody wants to know what that means, with the appropriate isolation and quarantines in areas that will reopen. And I've heard that we will need to at least triple nationally the number of people assigned to do that contact tracing. And some states are aggressively doing that, but not yet Florida. Mayor Jimenez does have a conversation ongoing with MIT to inform contact tracing, but I don't know what the level of staffing is contemplated. We need people who will be, I'm calling them sleuths, and they have to work with compassionate curiosity to go out and seek all of the people who may have been exposed. So the 3 T's to remember: testing, tracing, and treatment. Fortunately, we've not overwhelmed our local healthcare system. We've carefully monitored, and our hospitals have been able to keep pace. Combined with our social distancing and safer at home policies, we've been able to make sure that there's capacity if needed. And we're still aggressively seeking all the PPE. Everybody knows what that is these days, personal protective equipment, and to protect our seniors and vulnerable populations. So I have an acronym to try to remember what we need to responsibly reopen and recover. That would be the 3 R's. And this is secure. And the S is for safety net investment. So everybody sees the humanitarian crisis we have as people are desperately waiting for their checks from the federal government for their unemployment to go through, which has been a nightmare. And people are desperate. We're not evicting in the county. We're not turning off your water or your electricity, but those bills will come due, and people need food right now. They're desperate. So that is really, really critical. Again, the county has stepped up for seniors particularly, and food distribution, buying from farmers. That's so important, a win-win, but not enough to stem the tide going forward. And then the E is for expanded mass testing. Again, we're not anywhere near where we have to be. And let me just point out, we did start with the surveilling test with UM and the county in partnership, and we've discovered a 6% across the county infection rate, extrapolated to about 165,000 residents. I want to point out that Blacks, African American, and Caribbean are twice as likely to be infected than whites, Caucasians, and over half of the people that were tested in this antibody protocol showed no symptoms. So just remember, we're all possibly vectors for this virus. And that's also to say that of the deaths, 27% of them were for African American, although it's only 18% of the population. So the C is that we must confront and address the affordability crisis that families are facing. That has everything to do with the housing, with the jobs that exist in the economy, and also earned leave, which 83%, new poll, of the country support earned leave programs. We do not have a mandatory earned leave policy in Miami-Dade County, not even for our contract employees. I have legislation that will be going back for a hearing May 7th before the Chair's Policy Council. I hope that will get support. The U is for unemployment response, and we all know it's been abysmal. I just learned yesterday that the state has actually informed people to reapply if you applied before April 3rd, because the systems were not in place to deal with the more generous federal benefits. So people may have been turned down for state benefits at the low $275 per week rate. The $600 rate that's available through the pandemic unemployment insurance, that's finally up in our system, so people need to reapply. What a tragedy. R is for rebuilding our infrastructure. We have some federal bills coming along that will focus on that, as well as the increased funding for our federal and state government operation. And I'll say a little bit more about that in a budget section. And then our economic recovery for our hard hit sectors. We need to have relief for our small businesses. The PPP program is not going to go far enough. The targeted job training. We do have some funds. We need to aggressively pursue those. So collaboration, collaboration, collaboration. And let me say, I'm so glad we have so many representatives of local government. Fortunately, the mayor has been working with the League of Cities now. That's a critical component, and also a regional alliance. We have to work together. We're all interconnected to make sure that the response is understood and well implemented. So the most important thing of all I want to say here is we must be guided by medical expertise, not political agendas, and we need to have medical experts at the table every step of the way. So what about the immediate impacts? We've heard some from Dr. Frank. There have been a number of surveys conducted. I actually have one of my own that I'll be releasing results tonight during a town hall meeting at 6 o'clock. You're all invited. We also have looked at the one that was conducted by the Chamber of Commerce. They're reporting that 91% of the businesses said that they were negatively impacted by this virus. That's over the next 3 months. And 12% of their respondents have had to close down already. And 77% said that they will be negatively impacted over the next year. 47% reduced some of their staff to part-time, 43% reduced some of their full-time staff, and 3% actually increased their part-time staff. There is a great state survey as well. It's called the Business Assessment Survey, and I brought legislation that was passed to encourage all of our businesses and do an outreach effort to be part of that state response, and then we can disaggregate it to the county and hopefully even the city level, so we can see exactly how we're all affected. 77% of business owners are less optimistic as compared to before the outbreak. Okay, no surprise. Okay, I was asked about working remotely. So, you know, many people call that the white collar working remotely or the white working remotely, because we know that unfortunately so many of our essential workers and also manual laborers obviously cannot work remotely. So for Miami-Dade County itself, it's only about 30% of our workforce that could potentially work remotely from home. And it's taken a little while to move it forward. I've been really pushing about that, but gradually more and more of the county work has been conducted now remotely, including the building permit center basically closed, and we're conducting fast track remote processing of permitting through the digital platforms, and even doing video inspections. So, you know, we're never going back. We're not putting that genie back in the bottle. And hopefully we'll continue to have people working remotely, which will obviously assist in our traffic situation as well, something I've been pushing for a number of years. But again, our police, our animal shelter, our paramedic fire emergency, garbage collection, road repair construction, emergency food distribution, that cannot be done remotely. Finally, what about the budget? So the tourism sensitive taxes, like the hotel and convention taxes, are the ones that are going to be most affected. And also the proportion from state revenue that we get to our county. Gasoline taxes, as was mentioned, transit fares are down, and so on. So we're projecting at this time a 16% reduction in tourist taxes and an overall loss of about $170 million in revenue from that source. We are looking to the federal government, the CARES Act, to help us address many of these unanticipated expenses. We've already gotten funding in for our transit operations and for our airport, and we want to have greater latitude in the use of those funds or to address them in the next relief bill. I want to point out, we'll be hearing from the city of Sunny Isles. We know that a smaller city does not have that same advantage, but state and county funds can be directed to cities potentially, but we really want and hope that we're going to get direct assistance to our smaller cities in the next bill. Property taxes were already assessed. Most of them were paid by March. So from that perspective, our that portion of the county budget will probably more so be affected in the following fiscal year. We start October, and again, most of our property taxes will have been collected. The tourist-dependent departments, the airport, the port, have already revised their construction plans. They are self-financed, so it's all dependent upon the funds that are received to those proprietary funds. We've switched to more cargo, both at the airport and seaport, so we've adapted in that way. And of course, the airlines have as well been negotiating for big recovery, and that will help us at the airport as well. You know, we now are requiring that all airport vendors at the airport have to apply for PPP if they're eligible before getting the relief that the county will give them in reduced MAG, which is their rental payments. So we're, you know, the final numbers are not in, but we're hopeful that we'll be able to weather this storm. Obviously, we'll have to plan ahead for an economy that's based on the new economy, and look forward to learning from everybody what that will be and how we can support it. Thank you so much.
Thank you, Commissioner Cava. Next up is John Talmadge, who's joining us over the phone. John?
Hi, thank you. And can you hear me well?
Yes.
Okay, well, it's hard to follow such great economic developers like Ned and Howard and Daniela. It's a pleasure to be on here today from the west side of Florida. You know, from a big picture perspective, when, you know, I am an economic developer, that's my job. So that's why I've been focusing on that part of, you know, the event. So, you know, when we first went into the event, we were able to pivot fairly quickly. We set up a business call center that was able to put together a group of bankers and others to help get behind the PPP and help make sure applications were completed. So people, you know, where you were stuck with the national banks and had to work in these queues, we were able to create a, you know, at least a person-to-person system to find out where your application was, it was complete and whatnot. And we think we've improved the approval rate for Southwest Florida businesses because of that. And same with the unemployment insurance. We were the first ones to start advocating for the paper application when we knew the portal had gone down. And of the 120,000 paper applications submitted so far, I think 20,000 came from Lee. And we've been insisting everyone submit a paper application rather than online, because it had fields that you could go ahead and apply for a sole proprietor or part-time or whatnot. But, you know, just like South Florida, where we largely have the same distribution of types of jobs, not quite the same numbers, but the same distribution. And so working with the governor's office and the Florida Chamber of Commerce, we went ahead and did our own analysis of jobs, severe jobs at risk, medium jobs at risk, and low sector jobs at risk. And I think we've, the 330,000 employees we have today, we probably have lost 80,000 to 90,000 jobs because they're principally in the severe categories, which was the same as what you can imagine: hotel, restaurants, retail, real estate, construction. That said, 40% of our economy is really humming along. I mean, it's logistics, manufacturing, construction is all. There has been no signs of a slowdown in permit applications or development order applications. So, we think those sectors are weathering this. There's been some talk amongst the state, commercial real estate sector that Southwest Florida may be, not anytime soon, but may be a safe haven for businesses that don't want to be in such dense environments such as the tri-state area and whatnot. So, we're preparing for that. One of the things that we've all learned is that the need to have a more localized supply chain. And so, I have a weekly phone call with our healthcare logistics folks, or their supply chain folks, a weekly phone call with our national retailers and wholesalers to work on that. We've helped probably 20 businesses pivot from production of shoes or swimwear apparel into PPE and other types of medical related supply. And with that, we were able to set up a fund so that if you need to buy a piece of equipment or something like that, you have the ability to take out an interest-free loan to pivot along with us. And I think those efforts will continue well into the future. Some of the things that we are concerned about, and it is what it is, as the commissioner said, the unemployment system or income system has been a disaster. Everyone can acknowledge that. But once you're in, if you're in for the federal benefit, that's annualized at $32,000 a year. If you're in for the state and the maximum of the state and the federal benefit, that's annualized at $45,000 a year. When we choose to reopen, or when the governor directs us to reopen, and we, in the county by county, we decide what to do, there's going to be a conflict in between what someone on unemployment who may be making more than they made in the workforce, when they choose to go back and the ability of the business to take advantage of the forgiveness portion of the loan for having their payroll restored. And so that's a conflict we're worried about. And not only that, are we worried about that when, at least for the state of Florida, which is different than most states, when that benefit ends, the end of July, we're in the midst of hurricane season. And so if they continue that benefit into the fall, if they don't continue that benefit, you're going to have people either susceptible to a hurricane season, you have people dropping out of unemployment in August when no one's hiring anyway. So that's a concern that we're trying to work through with our workforce. I've been in touch base personally with 5% of our businesses in Lake County, which is about 6,000 businesses, through a series of video chats, just to begin to prepare them for that eventuality. And so helping give the guidance on what payroll means on the forgivable part of the loan is an essential part of our conversation with our business community, because right now it's not by the employee, but it's per the FTE, or the aggregate PT into the FTEs and whatnot. So we're paying close attention to that. There's a lot of confusion in the business community about FMLA, unemployment, and PPP, and so I think the more assistance we are able to provide and guidance, because the banks are still they're changing the SBA rules on a daily basis. There's still not complete guidance on what forgiveness looks like. There'll be a new application that'll be required, or some sort of paperwork that'll be required to go through the forgiveness process. There's a very short time clock, and as we've seen, every time the federal government has put a short time clock on something, it has crashed. There are going to be two economies coming out of this, and I think Howard really outlined this very well. But there's going to be two economies. So there's going to be our inland economy versus our coastal economy. We don't see hospitality and tourism rebounding, very quickly at all. We don't know how people are going to feel psychologically about going into crowded spaces, planes, beaches, hotel pools, and whatnot. We don't know what that looks like, and even if they relax everything yesterday, it's going to psychologically take a period of time for those sectors to rebound, as well as they're all looking for indemnification, so they can't be held liable if there's if a burst pops up at their facility or whatnot. The other problem that we're having, and which is a severe problem, is that we may require, if we require masking, if we require temperature checks, if we require different types of hand sanitizers, there's not enough supply in the supply chain to meet both the healthcare industry's needs and the business reopening needs. And so how do you, it's not a matter of getting 1 million masks, it's a matter of getting 2 million masks to Southwest Florida. And how do you make that and distribute it so it's available without getting in the way of the healthcare recovery? And so those are concerns that we're trying to address right now. We're trying to do it on a regional level because if Collier County does something differently than Lee County, then it's going to create a distance center for one county versus the other, and we don't want that kind of confusion as well. So I think that we're beginning to look at what reopening looks like. We're very concerned with our workforce. We're definitely concerned with workforce participation. This is a great opportunity to look at diversion and things like that to find workforce opportunities, because we already seen it in the restaurant sector where they're preparing to reopen and they're trying to bring workforce back, but the workforce is not willing, to those extent that they have to start receiving reemployment benefits, but they don't want to come back. So that's because we also heard that they may at some point remove you from unemployment if a business certifies that they've tried to bring you back and you refuse. So there's still a lot of confusion in that system. We don't expect that to be clarified anytime soon. So the best we can do is to try to help. I'll leave it to the commissioner and others to worry about to talk about government taxes. We know the gas tax will be very much impacted throughout the state, especially dependent very on that in Lee County. Sales tax, as you said, we've not got our April numbers, which we reported next week in May. We're not quite sure how far down in terms of loss of revenue. We have not lost that much revenue as probably something $1 and $2 million as a county. So we're not really down that far yet in terms of what we know. But April numbers will come out, and we will certainly have a much different opinion of where we are. With that, I will stop. I think I covered everything.
Thank you so much. Commissioner Vizcarra.
Good morning, and thank you for having me. I'll be speaking a little bit, Sunny Isles Beach specifically, and giving insight into our residents' experience during the pandemic. For those of you who don't know, Sunny Isles Beach is at the northeast corner of Miami-Dade County. We are 1.78 square miles, and even though we're small, we have over 22,000 residents. Of those 22,000, 25% are senior citizens, and 97% of us live in condos. So what that means is we're very vertical, as you can see by the slides, which I imagine you can see. By most of us living in condos, it means we don't have our own backyards or our own pools. We participate in a lifestyle where we have access to amenities, both in our condos and also outside of our condo communities in our cities. Our city has many parks that are strewn along the length of the city. We all live, Sunny Isles has developed into a very walkable community. We all live within walking distance of 1 or 2 parks, or sometimes more. We have bridges that connect us over and help us get safely over busy roads and canals that used to divide the city. What's outside of our homes is very important to our lifestyle, and we rely on that access to all these things outside of home, many of which are now interrupted. We don't have access to these things. With our senior citizens being 25% of the population, you can imagine when we started learning what this virus could do, it was like painting a bullseye on a significant part of our community. Therefore, we took very aggressive steps. I would say aggressive, but certainly proactive and we adopted very proactive policies for social distancing, including in having a curfew, which is still in place. We have also many families here, and they rely a lot on our after-school program for childcare. We have a lot of staff that works within that after-school program, and right now that after-school program is closed. So we have been able to keep a lot of that staff employed by having them make phone calls to our senior citizens, asking them what their needs are, make sure they don't feel so alone, and also do they have food for those who need it. Staff has been instrumental in getting the food distribution out there, but not just to our senior citizens. Keep in mind that we also have businesses here. We have 9 hotels, many restaurants, retail. They employ a lot of locals, and right now those locals are not working. And so the food distribution is also reaching, thanks to our staff, it's also reaching a lot of our families in need. Regarding specific residents' concerns, the median age here in Sunny Isles Beach is 48. So that means many of them are parents of school-age children and also have aging parents or elderly parents that they have to take care of. That is, if you're somebody who has kept your job and you're able to, well, a lot of us were already working from home, and many jobs were able to be taken home. So those people who are able to do that are expected to perform their jobs and also help the child turn in the homework and also tend to the parents. That is a pressure that they are feeling. But more than anything else, people are concerned about their income. Are they going to be able to keep that job? Are they going to get their hours cut? For those who have already lost their jobs, are they going to start working again anytime soon? They're worried about evictions. They're worried about maybe down the road having to face a foreclosure. They have also the concern we get, the biggest question we get here, in terms of emails and resident participation in our meetings is, when are the beaches going to reopen? And to me, that sounds like the question that's really being asked is, when are we going to get our normal back? Because we are a society, a community that does depend a lot on what's outside of our homes. And the beach is an important component of that. Another question that we get asked a lot is, when are we going to have more access to testing for the virus? Regarding specific economic impact to us, the concern going forward, it goes back to that 97% of us living in condos. That means condo associations, we're all economically linked when you live in a building and you're paying maintenance, right? So when my neighbor across the hall loses his job and my neighbor down the hall has her hours cut, one may stop paying the maintenance and the other one may pay it late or may not be able to pay it at all even. So that means that the burden of the association then for the entire cost falls on fewer people. And we went through a very rough time during the Great Recession in 2008, 9, 10. A lot of investors bailed and left fewer people recovering for everybody. And it was a difficult time for our buildings, and we're concerned that we may end up in that downward spiral. We are hopeful that the recovery will start sooner than later, because that is certainly a concern for us. And on that note, I just want to mention that on top of the policies that were implemented by the city government, the associations are adding extra layer of protection by what's going on inside the buildings, like limiting the number of people in elevators, demanding that masks be worn inside. If you thought you were going to get your hairdresser to remedy the problem that your salon was closed, some buildings aren't letting extra people in. So there's that extra layer of protection that associations are providing that I wanted to give them credit for, because every little bit helps when it comes to our social distancing. That's my time, so thank you very much.
Thank you. And next up is City Manager Chris Russo. Chris, you're muted right now.
Am I unmuted?
Yes, thank
Oh,
you.
good. Okay, well, thank you for having me on this. What I'm going to speak about is the actual impact to our city government operation and finances. Pretty much, as you can see from what Commissioner Viscara said, we've got every socioeconomic level in our city. I'm expecting this year to have about a $5 million impact on us. We made some good decisions in terms of our staff early on. One of the things we did, as Commissioner Viscara mentioned, not having school in session and not having our aftercare program, we had quite a number of employees, both mostly part-time and some full-time, that now had a lower level of work to do, we thought, in the beginning. And also, one of the things we did initially, right off the bat, almost, was we gave everyone in our organization an extra 80 hours of administrative time. And that proved to be probably the best money well spent, and it hasn't even half of it been spent yet. But this was flexibility to make our entire staff comfortable that they don't have to worry, especially if they're new employees that just never anticipated anything like this, where all of a sudden they may have to take care of their children, elderly parents, or other personal obligations. When we took that concern off their minds, things really started humming. The city, that was around the $600,000, maybe closer to $700,000 cost on us. We spent about $100,000, we expect, within the next month or two on overtime. We've changed all our operating methods, but we haven't stopped any of our services. And what I mean by that is just about everything we do that involves anyone from the outside, we can do by appointment only now. And it's worked. It's kept everything going from on limited basis, obviously, from our bus system to permitting in our building department to building licensing to any kind of appointments for any assistance or help or service that anyone may have. We also went to a schedule of who could work at home. If they can be productive, they were allowed to. This was all done through our department directors in each area, other than our police, of course, but they've been doing a fantastic job, and also our lifeguards with trying to control the social distancing and the closures on the beach. But that has helped substantially to, one, reduce the number of people that could be susceptible to any of the virus. We've also just started doing some level of medical checking with temperatures and things coming into our building. The economic impact that I mentioned of $5 million, besides the investment we're making in our staff and employees that I just mentioned, we've looked over our budget. We know a lot of it's been mentioned already, with the various sales tax, gas taxes, reduction in all of those areas. Another big one for us, interest rates on our invested funds was actually on the rise substantially towards the end of the year and the beginning of this year, and it just, it sunk after that. I mean, just to give you an idea, I know 2% doesn't sound like a lot, but 2% on our investments was quite a bit. That's down to 0.35 on average now. So we're looking at over a $2 million hit on just that alone. And, and who knows what may happen towards the end of this year. Our collections for taxes, property taxes, is pretty much on target right now. But again, we have to see what happens in next November. But our strength is our economics in the city. You know, in Sunny Isles Beach, our economic engine is the residential development that we have, and you know, that has held up. One of the interesting points with regard to that was the concern for construction workers still and being considered essential services. This is a very interesting dynamic. We've got about four fairly significant, well, two fairly significant projects, a third one just in the final stages of completion, and then another one that's smaller. But you're talking about 800 or more construction workers in the city that the governor and the county mayor deemed to be essential. There was a lot of you know, concern over that, but I have to say that number one, the economics, I'm sure, was a significant factor for the governor and the county mayor, because you know, you're talking about doubling the numbers of what the unemployment is right now, which is a record breaker. The work that the people that run these construction sites did to come into compliance from all the requirements. And we went even stricter than the county in terms of social distancing, wearing the PPE issue, right from the minute they get out of their car in our city to the minute they get back into it to leave. And some of these people are our residents. They've got families. There was, you know, talk about them as if, you know, they were of a lower class quite a bit. That was a little bit unnerving, but it's amazing how organized the management of these companies were to within a week meeting all the requirements, and they're abiding by it. So that's a credit to them, and it's been working out. That was I'd have to say that was a, you know, major concern that we've had. The hospitality industry in our city, they're obviously, as the numbers that have been reported by the you know, the Convention and Tourist Bureau, I mean, they're down 75%, and the difference is probably just what was taken, you know, during their first couple of months before their closures. I hope they get on their feet again. That's taken a hit to our city, and you know, like I said, we've got every socioeconomic situation in our city. Many of the hospitalities workers live in our city. With everything closed, as a commissioner mentioned, you know, there's been food drives, there's been other avenues to try to help these people. Some of the closed hotels actually started producing food and things for the workers. And in fact, I understand that that's carried on to become somewhat of a countywide program, where some of the hotels are having food prepared for their laid off workers. Let's see, most of our employees, we kept everyone, as I said, the part-timers, seasonal people employed. They've been really essential for us to you know, to help with the with all the other work that had to be done with sanitizing and things like that. So with that, I'll stop there. I could go on and on if I wanted to, but I know we have time. But thank you again.
Thank you so much. And we're gonna move on to the audience questions. So we've gotten quite a few, actually. So the first one's for Howard. Howard, can you address what fiscal impacts local governments can expect this fiscal year? Short-term impacts are of great concern.
Boy, I wish that I had a crystal ball. I would, I think I agree with Chris and with John. The next 2 months, 3 months may give us some indicators. My gut says this time around, I think residential pricing of property may hold up better than commercial. I think the stock market is sending a very interesting signal. If those of you who paid attention, some people think it's psychotic. We're within 15% of our highs after sinking. But I agree with the pundits who say that is probably a comment on the triumph of the large. That large and survivable are going to come out of this on the other side. So if I put myself in the shoes of a city finance officer, I might say, I'd look very carefully at what's going to happen to malls, because I think they might see a big downward trend. I would say my large restaurant chains, they're going to reopen, but I might worry about mom and pop operations. So that's, I think, my short, quick, dirty answer. I think Ned could probably, my colleague Ned Murray would probably have better answers on the real estate side. But I think that unemployment is a lagging indicator and the stock market looks ahead. So we may be getting a signal that says big and survivable will come out on the other side, and they may actually do well because of limited competition. That in the retail area, the restaurant area, yeah, your local Applebee's is going to have fewer competitors than it had a year ago or two years ago. So I think short term, it's going to be very, very sharp decline and a slow recovery. But again, I'd worry about commercial real estate and small businesses and think along those lines.
Thank you. Next question. This one is for Commissioner Cava. What current strategies are being developed to bring back employees that have lost their jobs during the COVID-19 pandemic? And also a follow-up question, in Miami-Dade County, how many people have lost their jobs in the county?
Okay, great. Can you hear me?
Yes.
Yes, okay. So as far as bringing people back who've lost their jobs, I think right now it's sort of sector by sector. Hospitality has a very aggressive effort through the Convention and Visitors Bureau and the Hotel Association, keeping track of their employees. Many of them were able to be furloughed rather than laid off outright, which is really positive. So, the bigger industries, certainly the cruise industry and so on. So they're keeping track to hopefully be able to reemploy once their industries recover. The cruise industry, for example, is projecting that they'll go back to cruising with new conditions, maybe fewer passengers and so on. And the hotel's the same. And many of our hotels are actually open, serving first responders, essential workers, people on isolation, some homeless population members. So obviously it's not at anything like the same level, but they are looking at, as soon as they get the go-ahead, which we'll be hearing soon from Mayor Jimenez what his plan is about that, to have precautions in place, extra sanitizers, temperature checks, the whole gamut of things that will allow hotels to open. And they're thinking that our local population will be the first to venture out. And even if the beaches are not open, that the parks are open and the boardwalks, and that there's a lot, people will be eager to take advantage of that. Just saying, I know the hospitality industry is working on Miami Shines is the name of the campaign, and they're very hopeful. They've also been able to keep a lot of restaurants going through the Miami Eats program and Local Heroes programs in different ways, like 1,000 restaurants are part of that program. So obviously that does benefit everybody. And we know that many people are going to need to actually be reemployed in different jobs. I've spoken to Rick B at Career Source South. They do have retraining dollars, but they have programs that are set up. So I am eagerly pushing to see how we can deploy those programs quickly, to see, obviously there are jobs in certain sectors, and we want to be sure that we channel people there. Let's go back to contact tracing. That's a job that really could hire large workforce. We want to be sure that we are first in line to train people who could do those jobs. As far as how many people have lost jobs, the unemployment data is really sketchy because of the difficulty getting through to the unemployment website. So, I think we don't really have an accurate count. I've heard about a 20% estimate. Potentially it could be higher because South Florida is so tourist dependent. So we have to see whether the tourists will come back and at what rate, again, starting with local. So, the unemployment system has been a nightmare for people to navigate, and, you can't get on despite hours of trying. A number of improvements have been made. Maybe that will translate into a more accurate account in the near future.
Thank you, Commissioner. This question is for the local government folks that have joined us. How has COVID-19 changed emergency operations for government officials? And how is local government preparing for the hurricane season in the middle of the pandemic?
Well, in our case, as far as the operation goes, it's not affecting our prep for hurricane season. Might have delayed a few discussions on some of it, but we're actually getting better prepared than we've ever been before with a lot of new equipment. The other impact, it's definitely, having to wear and be cognizant of having your PPE with you and on, and using the right discretion when they're handling things. It's difficult to tell people, the police, frankly, even though they have the authority to do this, it's not our style to, people give you a hard time that aren't supposed to be on the beach or somewhere else. We're not going to arrest them. We're going to talk them off the beach. So it becomes a little nerve-wracking for them sometimes too, as much as it may not seem that way.
I would add that in some ways the pandemic has helped us already identify some of the families that are in need, especially of food distribution, and who may be in need of other help. And right now we have already have a pretty good idea who they are. So I think that's a little bit of a silver lining.
If I could just add something here, we are converting our emergency operations center to a virtual center and planning aggressively for hurricane response, which is only 5 weeks away, the start of hurricane season, and stockpiling what we need in terms of extra PPE, because we know that if we're going to tell people they need to shelter with us, we're going to need to give them the space for the social distancing and give them the supplies they need.
Thank you. How are local governments collaborating with community-based organizations?
I'd like to speak to that. I'm very pleased that our food distribution is being conducted in partnership with nonprofits. So, of course, we have the large food distribution enterprises, Feeding South Florida and Farm Share. They have huge capacity. They're the ones with the warehouses and the trucks, but there's a network of smaller nonprofits that have been at the front lines feeding people at the neighborhood level. And so they're partnering together to get the food to people at the neighborhood level wherever possible. Because unfortunately, those food distributions are drive-through. You have to have a car. You have to have money to pay gasoline to drive through. And we know that you have to often line up wee hours of the morning to be assured of being one of the 500 or in some cases up to 1,000 households that could be fed through that drive. So the small nonprofits are really, really critical. And it was decided through the Parks Department, which has now been reinvented to be the food distribution lead, that we need to partner with our local nonprofits. So that has been very, very positive. There's also an effort through the United Way, Helping Hands, which distributes cash to needy families at about $1,200, I think, per family. And that is conducted through a network of nonprofit organizations. Also, the city of Miami has contract with 3 nonprofits to do advisement and support for small businesses to apply for small business assistance programs. So, there are many, many ways that the nonprofits are helping. That being said, we know that nonprofits are suffering themselves. The Miami Foundation has a special grant fund to help nonprofits through this pandemic, and we need to do more step up and help our nonprofits to be the hands and feet to serve the human needs.
Thank you. Commissioner or City Manager, would you like to add anything to that?
No.
Okay. Okay, so how will the county respond to homeless population transitions after restrictions are lifted?
Such a good question. You know, I've been really impressed with the fact that we've been able to secure hotel rooms for the homeless that need to be isolated. Now, obviously there's an issue, you know, some of the population really doesn't want to be isolated in hotel rooms, but many are taking advantage of it as well. And that's protecting themselves as well as others. When you saw maybe in the news, Dr. Armin went out and did the testing, the swab testing of the homeless, you saw that many of the homeless were very responsive, very eager to help. They recognize the threat to themselves and to others. So I heard it said on a national radio show that now we've learned how to house the homeless in hotels. You know, my education was in New York City, Columbia Law and Social Work School, and there I ran a program training people how to work with the homeless that were staying in single room occupancy hotels. You know, it can be done. The city of New York did it in a massive way, and we could do it as well. And that's one of the ways that hotels have been contributing as well.
Thank you. We have time for just a couple more questions. So we received this one on how is local government responding to renters, specifically as it concerns rental moratorium, assistance to those that cannot pay for their rent. Is anything like that in the works, or how is the local government sector responding to this?
Yeah, well, I guess I'll start off on that. So first of all, again, the county is not honoring any eviction orders. So a landlord might still go forward with an eviction process, but the county police that would have to execute on it are not doing so during this emergency. Unfortunately, that doesn't mean that the rental costs go away. So, and we've also heard horrifying tales of landlords taking it upon themselves to basically constructively evict people by turning off the utilities in a manner that makes the place unfit to habitat. So we know it's difficult for landlords too, because they have to pay their bills. Fortunately, at the federal level, any federally guaranteed loans are extending time on the back end of the mortgage. So that hopefully will lead to a good percentage of landlords, both commercial and residential, extending the terms of the lease. And we do encourage renters to reach out to the landlords and try to negotiate delays, reductions, whatever you can do. And many landlords who are able to are extending those benefits. The city of Miami has provided some rental assistance. Maybe I saw Hialeah had as well, one other city. So far, the county has not done that, offered rent assistance, something that definitely will need to be explored as the delays in unemployment or stimulus checks are realized. So those are some of the ways. There's a movement to freeze rents at the state level. There have been requests, but the state has also tolled evictions. There are no evictions during this time, but again, the cost of the rent doesn't decrease and doesn't go away.
Yeah. As far as the city is concerned with this, we've stuck with the county's order on that. I'm familiar with the program that the commissioner is talking about. It's the Urban County Consortium, which is a federal grant program that we do not qualify for, but the city of Miami and Hialeah probably can benefit more substantially by directly applying to them. I'm sure they qualify, but we had, frankly, I haven't gotten any complaints on that. I get more complaints on the beach and the construction workers than anything else. But this is an issue that we left. We didn't see any reason, since we're not directly involved in it, to supersede the county's order on that.
I do want to add that if anybody is benefiting from a Section 8 or they're living in public housing, that rent is based on income. So they need to obviously communicate with landlord to get the rent adjustment.
Thank you. And we just got one more question. So we'll answer these last two questions and we'll end the session for the day. So since we are primarily a service-oriented economy in South Florida, how will the government respond? How will government services bolster to assist our service-oriented employees?
Well, I mean, we've been talking generally about the kinds of relief and programs that could exist. And I think I took note of Dr. Frank's lessons on the subject, that we're really not geared appropriately to understanding the nature of our economy. So we really need to look at that point. But that being said, we will still be a service economy. I think we need to really be aggressive about finding the kinds of retraining and reemployment type programs that could take people that are comfortable in a service economy. Again, just using contact tracing as an example, that's somebody who is gregarious, is able to speak easily with the public. These are jobs that we may need. Certainly there's more jobs in public health generally. So we need to, we have a temporary lift on people in the medical field being able to practice even if they have foreign degree, things like that. So we need to find ways to kind of expand access to jobs for people who have skills. And I think we need to be creative.
Yeah, in our local situation, it's simpler than the counties, but we try to we try to be as flexible as we can, whether it's with the hospitality industry or whether it's with our retail sector. Those are the two big ones that most of the time need a little extra help, where we bend the rules and things. And in situations like this, we're certainly going to do that.
I'd just like to add that I think the whole world is getting a new appreciation for these essential workers. So, the people that are exposing themselves for our benefit, whether it's delivery, food preparation, grocery chains, all of these are people that have been, frankly, paid less than they deserve, and without sick leave very often, and without health insurance, and disproportionately, by the way, African American or disadvantaged communities. So we need to really rethink how we value the employees as a result of this pandemic.
Okay, and this last question: how does opening up? What will that look like for our local government folks?
Anybody else? I've been doing a lot of talking.
I would hope that it is gradual, and that maybe we can go backwards, right, in the way that we close things down, starting with the parks, and I think we need to observe how well people adhere to the rules, because it's not going to be the same normal that we're used to. We're still going to have to be careful. And how quickly we proceed with reopening everything else, I think, will largely depend on how well people react. I don't know if Chris wants to speak more specifically.
That's really it. I mean, we want to be careful. The biggest fear right now ahead of us is that there's a relapse come the fall, after the summer.
Yes.
Through the summer. We don't want to start all over again.
Great.
Yeah, I would just like to add, I went through this in my presentation in detail, and I will provide some written points that can be shared as well. We cannot proceed without adequate access to testing, without tracing, and we don't have those pieces in place. We're in a kind of wishful world, like an aspirational opening. People are keen to get out. We do know that people will vote with their feet. If people do not feel comfortable, they don't see the necessary precautions, they will not go out. Many will, of course, some are, they think they're, impervious. But for many of us, we are looking closely at whether we feel comfortable to go out. At the same time, we've been told repeatedly by medical personnel that until we have a great increase in the testing and in the tracing, that we are not going to be safe.
I'd like to add to that. I second the commissioner's sentiments. We had actually scheduled at FIU classes for the second half of the summer, and they were canceled last week because there were no takers. We had scheduled face-to-face classes. There were no takers. And I think there's general sense of relief among faculty and students at FIU that we, at least in our school, we are going to be remote or online in the fall, because I think there's a real deep concern that it's just out of personal safety that we're really, the congregation right now is still a fairly high risk behavior, and trying to clean or sanitize large environments are tough, and even trying to eat is going to be very difficult with social distancing. So at least speaking from the FIU perspective, which you could argue is a sort of mini small city with, I think there was relief that we were going to be remote or online this coming fall, at least in our school. So I think there's consumer concern. How's that sound for a reopening?
Well, you know, the nation has learned so much about this, and it's really quite astonishing the extent to which there's public awareness and understanding of this issue and compliance, which is very fortunate. But I'll point out that in my district, last night, the Palmetto Bay voted against opening parks, despite the county opening parks, also Cutler Bay. So you could see that, and that was based, I believe, on public outcry. So just exactly what you're saying, Professor.
Thank you once more, everyone, for joining us this morning, especially to our panelists, Commissioner Living-Cava, Commissioner Vizcarra, City Manager Russo, John Talmadge, and Dr. Howard Frank. This concludes today's webinar discussion. As a reminder, we will be emailing all participants a link to the recording, as well as a link to next week's session, where we will be discussing the nonprofit impact of COVID-19. And if you have any questions, please feel free to email us at metcenter@fiu.edu. Thanks once more.
Thank you.
Thank you.
Thanks, everyone.